Yesterday on the morning show, I told you about the new report that found doctors performed tens of thousands of unnecessary procedures in 2020. And the two questions to ask your doctor so this doesn't happen to you. Well, this morning I'm talking specifically about dental work. Yes, regular dental visits are very important for your oral health. But beyond that cleaning and checkup, do you always need those recommended procedures? And what about getting a second opinion? Consumer Reports experts looked at 5 common dental procedures to help you figure out if and when you really need them. Sitting in a dentist chair, the last thing you want to hear is that you'll need a filling, a crown, or a root canal. But do you always need every procedure that's recommended?
There's a lot of gray area in dentistry, and there's not always one right answer for a given problem. Some dentists may also pressure their patients to get more expensive treatments. So that's why it can be wise to get a second opinion.
In fact, only 27% of people have ever gotten a second opinion on a recommended dental treatment or procedure, according to a recent Consumer Reports survey. Consumer Reports asked for advice from dentists to find out what you should do if you're told you need a procedure. Take a routine procedure like a filling. Replacing or repairing a filling can be important when they're damaged, but be careful if your dentist recommends replacing them simply because they're old.
Age alone should not be the only reason for new fillings. So push back if your dentist recommends replacing your fillings just because they're old.
If your dentist recommends a root canal, make sure they perform an adequate test, which might include x-rays and a sensitivity test. And if your dentist recommends pulling a tooth, consider asking if there are ways to extend the life of the tooth, because an implant can cost you thousands of dollars.
A tooth extraction is generally the last step for a damaged tooth, so if your dentist recommends an extraction, ask them to explain why and consider getting a second opinion.
To find a dentist for a second opinion, Consumer Reports recommends asking friends and family or searching on the American Dental Association site. And be sure to ask for your records, including x-rays, to give to that second dentist. Consumer Reports says when you do ask for that second opinion, don't explain what the first one was, so the new dentist can examine you without any preconceived notions. For a direct link to Consumer Reports' full story to read before your next trip to the dentist, go to news4jax.com/Consumer Reports. There you can also watch yesterday's story on overused medical treatments and learn the 2 questions to ask your doctor before you agree to a procedure.